So some of the main messages that have come out from the research that we looked at for children during those early years is that their environment is and their exposure to kind of risk or to protective factors in their environment is actually a major shaper of their mental health and emotional well-being. And one of the major environmental potential supports that they have at that stage is their parent, father and mother, and we know that, for example, that if a mother during pregnancy or during the first year of a child's life suffers poor mental health herself, and there's not quick action to support mothers, then we know that that has a negative impact on the child's mental health going forward. There's also evidence to suggest that a father's mental health during that period, which again we also know that there are higher rates of poor paternal mental health during that perinatal period as well. We also know that they are a critical buffer, particularly if the mother's mental health is suffering. So looking after a parent's mental health and being alert to any deterioration and treating and supporting quickly is really, really important for a child's mental health. I think there's also something about those first few months, the critical role played by sensitive parenting and warm parenting, helping a child to develop a strong attachment, to feel safe, so that they then have a platform to go out into the world and explore and start to deal with adversity as they meet it, having initially been protected and buffered through their parental relationships. So the main messages from the research for as far as primary school age children are concerned are really that school environment for the majority of children is a second kind of critical environment, which can help both counter some of the risks that a child might have faced previously. For example, we know that maltreatment, family maltreatment, can compromise a child's mental health and emotional well-being, and schools can provide a setting where children can feel safer, and where they can build resilience away from perhaps a less than optimal family setting. But it's also a setting where children encounter new environmental risks. For example, bullying can begin as early as primary school. Obviously, it goes on into secondary school and is much more common at that stage. But bullying can begin at that stage, and we know that bullying has a significant impact on both children's mental health as they move into adulthood, but also on a whole range of other outcomes like their employment, their ability to sustain employment, their educational achievement, and so on. So schools can play a really critical part by providing a whole school approach where they support children through a psychologically informed and supportive environment for their development of strong mental health and emotional well-being. So the key issues affecting young people aged sort of 10 to 15 years tend to be that we see an increase in diagnosable mental health difficulties during that period of time, and we begin to see a shift. Although young men are more likely to present with diagnosable difficulties at that time, and usually in the form of behavioural difficulties, we begin to see a shift towards greater emotional problems developing particularly in young women. And you see the emergence of, for example, greater rates of self-harming as an expression of emotional distress, and also body image issues and eating disorders at their early stages. And the difficulties are that often when they're at those early stages, or when young people are self-harming because of the stigma and shame of those activities, it tends to be overlooked and to bubble under rather than to be picked up. When actually there's a really key opportunity to intervene early. During those years, what we tend to see is a shift really from what has previously been a greater likelihood of young men, boys and young men, having diagnosable difficulties, usually behavioural difficulties, to young women having a greater likelihood of emotional difficulties, and that trend continues across adolescent years. I think what we're also picking up really, although it's very difficult to get a clear picture of whether diagnosable mental health difficulties at least are increasing over time. There's very mixed evidence about that. We are picking up at the moment that there is something going on, particularly for young women, that seems to be detrimental to their general mental health and emotional well-being, and this evidence comes from a range of surveys that have been completed with young women over recent years. And they point to the source of this increased distress amongst young women, sources as being linked to bullying and cyberbullying particularly, and social media, linked to body image dissatisfaction. And also to a general kind of decreased life satisfaction that's been tracked over time, which is particularly affecting young women. I think academic pressures are also in that mix that seems to be undermining young women's mental health and emotional well-being. So I think, again, schools play a particularly critical role during those years, and particularly providing a route for identifying children and young people who are beginning to struggle and move into crisis rather than waiting for crisis to occur, helping young people get that effective early help, which we know, particularly during those crucial teenage years, can prevent long-term mental health problems if they can get that help early. I think really the main issue, the main challenges facing older adolescents and young adults are the fact that we organise services in a way that doesn't match really what we know from research. So there's a huge gap in service provision at a time when young people are most likely to develop diagnosable mental health difficulties. And when they're least likely, ironically, to even want to approach services. It's the peak time, really, for a young person to develop a diagnosable difficulty. So it's a critical opportunity to intervene early, and we miss it at present on the whole. I think it's a time also when young people are moving towards greater independence, so their parents are less involved, their peers are more important, so they're more likely to approach peers for help. And there's indication from some of the research that peers are good sources of support if they themselves have good mental health awareness. And particularly if they know when to support a friend into services which can provide really critical mental health support that's required. So, for example, with depression, where there's risk of suicide which is more common amongst young men, it would be really important for a young person to access effective help early rather than avoid that help. So around 20% of 16 to 25-year-olds will have a diagnosable mental health difficulty at this time, and what we see is an increase during this period once again of rates of diagnosable difficulties at that stage, and it tends to be mostly in the form of self-harm, depression, anxiety, trauma, post-traumatic stress disorder, and eating disorders at this young adult stage. And it's the time when we tend to see things like if someone has experienced childhood trauma, it's the time when it starts to surface and can often create mental health crisis as a result of those earlier negative experiences. We tend to see during this age group as well a shift from young men having greater levels of diagnosable difficulties to young women now having many much higher levels of diagnosable difficulties, which tend to be much more focused on emotional distress and anxiety and depression. And we also know that it's during this period that 3/4 of those adults with a diagnosable difficulty will have had their first symptoms by the age of 24. So it's a really peak period for the emergence of first mental health difficulties, and a peak period to again mitigate the risks of prolonged poor mental health during the course of an adult's life.